Okay, this right here is the digastric. It's a lingual, digastric, stylopharyngeus, external carotid. And then the styloid is this thing here, and the glossopharyngeal nerve is that thing right here, and that's right on top of the carotid. Well, the needle, when it's put on the front of the pillar at the base of the tongue, comes out right in this area and kind of avoids it. Now, just for purposes of the ultrasound, the internal jugular is there. Here's the accessory, the internal jugular. And so all this stuff, which would include the lingual, digastric, stylopharyngeus, external carotid, are all outside of the styloid. Because here's the carotid, and then below that is the external jugular. Now, I don't know if you could assess where the styloid is because I haven't been able to see it on ultrasound yet. But I wonder if it would restrict the ability of the external jugular to bulge at this level. Whereas with the Valsalva, you can make the external the internal jugular bulge. I wonder if that would restrict it from bulging, and then you'd be able to pinpoint it. The carotid is here and more anterior. The external jugular is below here and more posterior, but a little lateral. So we're really talking I wonder if you could inject between the external jugular and here, or just in front of the the internal jugular, up at this level. I wonder if you could go to the internal carotid, not going into the external jugular, but that the landmark would be the internal carotid at this level, and inject some local, making sure that it doesn't go into the internal carotid, obviously, and allowing the patient to just breathe normal so the internal jugular doesn't bulge and get in the way. So this would be a head-up position at this level. Because it's very difficult to see this styloid. So I guess it's conceivable that you could do a test or a study and figure out what level it would be. Now, the other thing that I did note is that you can find that first, well, you could see a transverse process, at least on myself. I wonder if that would be a good level to do it at. I don't know. So we'd have to see on cross-section anatomy. So again, this is the external carotid, digastric, stylopharyngeus, lingual. You can see that the internal carotid takes off and goes in. This is the external here. So you'd want to go further in than the external, not quite as in as the internal. So you'd want to go in between those two, and if that's possible, then that's where I would inject, between the internal and external carotids. And so I'm wondering if just injecting just in front of the carotid, internal carotid, would be the smartest thing to do. Because seeing the styloid process with ultrasound is too difficult, as far as I'm concerned. And then this is the accessory. accessory, jugular, lingual, carotid, common carotid, external carotid, digastric stylopharyngeus, styloid process here, glossopharyngeal nerve here, and internal carotid here. There's the internal carotid, glossopharyngeal, and this is on the right side of the patient. Styloid process is here. The exit for that going on the foremost area between the tongue and the pillar is here.